I talk a lot about rotations of the pelvis, especially anterior rotations, because they're so common, but you can have lots of other things that can happen with the pelvis. The pelvis can rotate in, can rotate out, can rotate up, or can slip up. So I'm going to just touch a little bit on an upslip, which is a common phenomenon where one pelvic bone is shifted up relative to the other. Now, it's important to make sure that an upslip is actually an upslip, because an upslip can look like an upslip, but it's actually a rotation. And the best way to test that is through a supine to sit test to see if that leg length difference stays long in both positions or stays short in both positions. If it goes from being short to long or long to short, that's more of a rotation. And there's many times that I've had people come into the office with what they thought was an upslip, was actually a rotation and related to tension in the iliacus. If it is a true upslip, it's usually a result of two muscles, either the psoas, so you can imagine if the psoas muscle was tight and it was pulling, it could pull the whole pelvic bone upward. So it could be tension in the psoas, which needs to get addressed either at the spine and the back here where it attaches, or in the front of the hip, or both. Another common reason why there's an upslip can be related to Quadratus Lumborum, which attaches to the bottom of the pelvic bone here and to the ribs here and can pull that whole pelvic bone upward. Typically, Quadratus Lumborum tension is a result of tension in the front of the hip. So the iliacus is tight, pulls the pelvis forward, shortens this muscle, and then it kind of cramps up and pulls that pelvic bone up. So to address the Quadratus Lumborum, you absolutely need to address the iliacus. In addition, you can put pressure on the Quadratus Lumborum. And then to address the psoas, we can use the ball, the hip flexor release ball on the front of the hip, or the hip hook to put pressure on the psoas here, and then having a practitioner work in this area to release tension there.